Good afternoon. I'm Meryl Oyomno. I'll be presenting on the feasibility and implementation of a national colorectal cancer screening program in South Africa. As I did mention previously, I'm from South Africa, the land of Nelson Mandela, the Springboks, four-time Rugby World Cup winners, and I am a colorectal surgeon based at the University of Victoria's TB Academic Hospital. The why to my project is framed around what Archbishop Desmond Tutu said. He has a quote that talks about, at some point, we need to stop just pulling people out of the river, and we need to go back upstream and try and find out exactly why they're falling in the first place. We need to save lives. Colorectal cancer incidence is increasing in sub-Saharan Africa, and majority of our patients present late with stage 4 or stage 3 disease, which is diagnosed, and that results in high mortality rates. This is a preventable and curable disease with screening. My stakeholder analysis involves speaking to the adults or study participants, the nurses and the doctors who are working in the primary healthcare facilities, academic and regional hospitals, and also speaking to various institution leaders in the Department of Health, Department of Home Affairs, and also the National Cancer Registry and South African National Cancer Prevention Services. I needed to find out if the participants would be keen to take part in this study. Most of them are willing to give source samples and keen, but they needed education, which we'll need to do by giving pamphlets and doing interviews. The concern I have was around compliance and sample return. Hence, we're going to be running a pilot to be able to see this. There was also concern in terms of the nursing staff being overworked and understaffed, and that would limit their commitment to the project. To overcome this, we thought of including additional nurse in the clinic just to assist with this and just to be able to see if this would be a sustainable project. In terms of dealing with the institutions, there's a lot of institutional inertia and bureaucracy, and that I would have loved to have that simplified. So how the project is to run is that we want to do this at primary healthcare level using the nursing staff to do fit stool tests for patients. This is supposed to be a 2-year study. And in terms of the study, our hope is that we'll be able to screen at the local clinics and then refer to the regional hospitals that cover that area for the patients to have their colonoscopies done within 2 weeks. The challenges, as I mentioned, was the bureaucracy, and also dealing with contracts and POPI Act and consent for the patients, and trying to come up with contracts that would be, and consent forms that would be ethical and bindable to be both the Department of Health, both the Department of Home Affairs to give us survival data, and the universities and ethics committee standards also. We needed a sustainable funding model. I had opportunities to learn about leveraging resources and managing a project and leadership at a national collaborative multi-institutional research level, and also getting exposure to learning and healthcare costing. The tools I gained would really help me to be able to inspire action and influence at a broader level. It has increased my awareness of my underdeveloped areas in leadership that I have to work on, and to be able to recognize that I need to lean into discomfort. That's where the challenges are, and that's where most of the growth happens. And in conclusion, I'd like to say that we are the ones that we have been waiting for. If we want to see change in our country and institutions, we are the ones that need to activate and action that change. Thank you very much.